Yeah, so as I said earlier, this kind of follows on a bit more from the prescribing talk I was doing earlier. So this talks about the Child Health in Practice Week itself and whether or not the students felt more prepared for clinical practice because of the CHIP week. So we were getting a lot of feedback from students at NUH, particularly on the paediatric attachments, saying that they weren't getting enough time on the wards because their timetables were so packed. Because we actually deliver so much teaching, they actually found that they weren't getting very much clinical experience and patient exposure. We also found that they were kind of having some problems getting teaching on the wards, so junior doctors who were very stressed and running around time pressured, so students who felt they weren't safe going and seeing children on their own because they weren't used to it, because we have a lot of students who don't have any experience of being with children, and just sort of comments like that, which meant we wanted to have a look at a way to get the students more involved on the wards, really. So the way we did this was to design the CHIP week. So the CHIP week itself was a week of their 8-week attachment where each student was attached to a base ward. On that ward they had their photograph and their names and who they were on the ward. I've been spoken to all of the nursing staffs on the ward, all of the F1s, F2s who were working there, as well as the consultants, and explained what the students would be expected to do on the ward, who they would be, and they knew which student they were having for each week of their attachment. So there was an expectation that this person was going to be there, and they knew who they were. The CHIP week itself, we attached the students to a junior doctor on that base ward, and said to them, what we want you to do is we want you to shadow this junior doctor, a bit like the old school assistantships, but then we gave them a bit of guidance as to what we actually wanted them to do as part of it. So we gave them some simulated tasks, which some of it was the prescribing. We gave them a booklet which had things like space to provide job lists, practice doing discharge summaries, TTOs, things like that, and for the actual patients they were seeing on the wards. As well as that, we were asking them to do real-life things, almost instead of the junior doctors or alongside them. So things like reviewing patients, they would go and see the patients with the junior and do the reviews with them. We would get them to clerk their own patients and then present them to the registrars, consultants, whoever were there, and they had to get a certain number of those done while they were on that week. We got them to document on the ward rounds, again for a certain number of patients, they had to document on the ward rounds, hand over the patients that they clerked, and this was the first time as well we got the medical students actually doing clinical skills in paediatrics, because I know that although there's no kind of rule that the medical students don't do clinical skills in paediatrics, it's something that I think is a bit feared. So we gave them a bit of a clinical skills log as well, which very clearly set out kind of which clinical skills they could perform, always under supervision, and it was made very, very clear that their clinical skills for paediatrics were always performed under supervision. And the clinical skills we want them to observe rather than actually perform. And then gave them a bit of space to go and ask if they could do certain clinical skills, but they had to kind of have a signature to say that they were fully supervised with bits and pieces. Things like G-tube insertions that we don't always do, for example. So all this guidance was in this little booklet that they got along with their prescribing tests. They took that with them on their CHIP week and went where hopefully the junior doctors and the nursing staff were all expecting them and spent that week on that ward. During that week, they could go to teaching, but they weren't expected to, and they were very much told that they were to prioritise ward-based activities rather than attending sort of the teaching that was being provided for the rest of their firms. The way we work in NUH is each student is part of a firm of about 6 students, and we took 1 student from each firm per week out to do the CHIP week. So there were a number of things we wanted to improve with the CHIP week. Firstly, we wanted to get them ready for their F1 posts, particularly in paediatrics. So they've said, actually, paediatric experience was to be quite limited. We wanted them to get some general skills that would be useful across F1, so things like prescribing, handovers, communication skills, that kind of thing. So what we did to kind of test whether or not the CHIP week had helped with that, we'd given them a pre- and post-questionnaire about the CHIP week. So before they started, all the students got given this questionnaire and they were asked to rank how prepared they felt for F1 and performing certain skills within paediatrics. So we looked at things, again, like handover skills, documentation, and everything that I've just been talking about went down with this questionnaire. And then once they completed the chip week, we then redid that questionnaire, exactly the same, and asked them to again rank their skills post their chip week. So there were 34 students who completed the chip week in total. And then what we did is we looked at their ratings of each skill and compared them from start to end using the independent t-tests. So we'll go into this in a little bit more detail. So just highlighting in red here, these are the questions where students felt that they had improved their skills across the chip week. Now, actually we had quite a good significance, as you can see here, so very good p-values for doing this. But what that actually translates to is this. Okay? So we found that general preparedness for F1 increased post the chip week. We found that they were more confident managing common paediatric problems, communicating with parents, paediatric prescribing, handover, and that they felt more included as part of the clinical team and felt more comfortable being on the wards. Interestingly, they didn't feel that their leadership or team building skills improved, which surprised me considering that they felt more part of the clinical team. So from this, we kind of wanted to have a look at introducing the chip week more widely with these promising early results, although we recognise it was quite a small sample size just from one cohort, so we'd like to get a bit more data and kind of run the programme again to see if that, that change continues throughout. Do you have any questions?